Well, for more on the situation in Brazil, I'm joined live via Skype by Anya Prusa. She's a senior associate at the Wilson Center's Brazil Institute. Welcome to the show.
Thanks for having me.
So where does Brazil stand in terms of case count, hospitalizations, and COVID variants compared to its neighboring countries?
The situation in Brazil is incredibly serious, and what we're seeing is that neighboring countries are actually taking measures to isolate themselves. So in Uruguay, for example, they're prioritizing vaccinations along the border with Brazil in an effort to create, in essence, this barrier, this vaccine barrier between their own citizens and Brazil, which is widely seen in the region and around the world as having no control over the spread of the coronavirus.
So then what would you say are the hardest hit regions of the country?
Well, certainly we're seeing a disproportionate impact in areas that were already poor, where there's a lack of hospital infrastructure. We saw Manaus in the Amazon region in January was really the first indicator of the collapse that we're seeing now across Brazil. In many areas and in the rural areas, there might be only one hospital, and people might have to travel by helicopter or by bus in order to get to an intensive care unit, which really complicates the response. That said, certainly the areas that are seeing the highest number of cases are the urban areas. So if you're looking at Sao Paulo right now, for example, the situation is very serious. We're seeing hospitals across the city of Sao Paulo are full. 90% to 100% capacity, running out of medications, running out of oxygen, and the other things that they need in order to treat COVID patients.
So then what's behind this rapid latest rise that we've seen in cases and deaths?
Well, certainly the P1 variant, which was first discovered in Manaus, is part of that. It is highly contagious, and we've seen it spreading across Brazil and increasingly beyond Brazil's borders. But also in Brazil, there has not been any sort of consistent countrywide effort to contain the spread through social distancing, through the wearing of masks. And so you're seeing it also because of this, right? People are still going out and working. They're still going out to the shopping malls. There's a lot of economic activity still taking place. And it's really fallen to the individual city mayors and to the governors to try to take measures to improve social isolation.
So then, to that point then, how has the Bolsonaro government responded to COVID over the last year, and has that position evolved as we've learned more about the virus and how it spreads?
So from the beginning, Jair Bolsonaro and his government have really focused on the economic fallout and trying to keep the economy open. They have prioritized that over the human cost. Right, so they have not focused on the measures that we know, based on science, actually help reduce mortality and reduce the spread of COVID-19. And as we've learned more about the disease, and as the disease has spread and evolved with these new variants, we have not seen any change, right, from the Bolsonaro government. They continue to say that people should not be staying at home. They should be going out and working and kind of being active outside of their homes.
And so, as you mentioned, the Bolsonaro government's focus on the economy, how has the economy then evolved, given the situation that Brazil was in even before the pandemic? How has COVID exacerbated it?
Yes, so Brazil was already facing economic headwinds, sluggish growth, even before the pandemic hit. And once we saw, the economic ramifications, Brazil actually took a very proactive approach, right? They launched this massive stimulus program last year in 2020. They spent about 8% of national GDP, actually, and it was successful. Right? They actually reduced poverty in Brazil in 2020. It fell to about 4.5% in August, down from about 11%. So that was a significant achievement. But it was intended to be this kind of one-time emergency program. And yet the government did not take the steps necessary to actually get control of the emergency, right, which is COVID-19. And so we're going into the second year of this pandemic, and there isn't as much money left. The government can't continue to make these types of emergency payments. And yet we're seeing that the need is still there, right, because the pandemic continues to spiral.
And we did see that the National Confederation of Industry expects unemployment to climb to 14.6% this year, and that they expect recovery of activity to begin in May. What's your take on those projections, and what does that mean then for the labor market and for businesses?
I think employment is going to remain high, right? We saw at the end of the year it was closing at about 14%, and so I expect it will stay there. I think the idea that the economy will reopen in May is optimistic based on the vaccination rates. We've seen only about 2% of Brazilians are fully vaccinated, right? When they've had both doses of a coronavirus vaccine. Only 7% have had the first shot, and there are huge shortages of the vaccines across Brazil right now. And I think because there are no social distancing measures in place, because people don't wear masks consistently, you really will need a vaccine rollout to be far more complete before you'll see people going out and participating in the economy at the levels that we might have seen pre-pandemic.
Well, thank you for your insights. Anya Prusa there, Senior Associate at the Wilson Center's Brazil Institute.